Hello, everybody. How you doing? My name is Kody Followwill. I'm one of the investment advisors here at Lake Point Advisory Group. Lake Point Advisory Group, we're a retirement and wealth service financial service firm. If you're not familiar with Lake Point Advisory Group, we do the whole comprehensive wealth management, and we love to host these monthly food for thoughts. Typically, we host them about retirement planning and what's going on in the market. But today we want to be a little bit different and go over a hot topic, Medicare. So I wanted to welcome the audience. There's a lot of us in here. All of your cameras will be off, but we want you to interact with the Q&A box. You'll see that down in the Zoom. Any questions you have, I'm going to try to filter through and get to everyone's questions. But let me introduce our panel. These are the experts. So we've got Tanya Boyd here. She's the president and CEO of Tanya Boyd Associates. It's been around about 15 years. She likes to work with you in place to put you in the right benefit package, right plan design, your HR needs and support. And welcome, Tanya.
Thank you so much.
Yeah, and one of her teammates, Chris Renfro here. He's additional support for Tanya. He's going to be the star of the show today. He is the expert, as we can say, very much the expert when it comes to Medicare. Welcome, Chris.
Thank you very much for having me.
Yeah. And if it's okay with you guys, we're just going to jump right into it, jump into some questions, and then kind of just have a conversation. Is that okay with y'all?
Perfect.
Fantastic.
Awesome. All right. So let's see. Let's start off with what can you tell the audience about the annual enrollment period? What does the audience need to know about it?
Well, currently we are actually in the open enrollment period for Medicare. What clients really need to understand, or people over the age of 65 need to understand, is that open enrollment period applies to two things: Medicare Advantage plans and Medicare drug plans. It does not affect your Medicare Supplement plans. They're not subject to the open enrollment plan. So annually, you need to be reviewing your drug plan specifically if you're on a supplement, because the companies get to change their formularies. They refile their plans every year. They're filed by county, except for drug plans are filed by state. And everything can change, from preferred pharmacy networks to specific tiers of drug tiers and drug type structures. So you need to be doing an annual review of those drug plans specifically, and that is from October 15th through December 7th is your last chance to make those changes.
Okay. Awesome.
Chris, how many drug plans are there this year?
There are, I believe I last saw 26 different drug plans in the state of Texas this year. That's down from 35 in the previous year because you've had some acquisition of companies in there this year.
So that's a lot to choose from. So there's no simple, it's not a cookie cutter. We're putting in the drug plans and dosages and pretty much come up with the best plan per insurance company for the least amount of out-of-pocket exposure. So that is the one thing that people do need to make sure they pay attention to, because if something happens in June and they want to change their drug plan, they're out of luck.
Yeah, and what people don't understand is that, or what they try to have an understanding about is the plan that we put them on for this past year is really working great. They have no concerns. They have no questions. What they don't understand is that plan changes as of January 1st. So if they haven't done a review to see how that plan is going to continue to cover them going forward, they may have a rude awakening going into the next year. And the problem is, after that December 7th, you're stuck for another 12 months. So do yourself a favor and review that, because it doesn't just come down to it being the same as what happened last year. It's never going to be the same. And there is no allegiance for you to stay with one company year over year over year. There is absolutely zero value in that. It needs to be an annual proposition for you to review that.
Chris, what if somebody just says, I don't need a drug plan, I don't take any drugs, forget about it, I'm not going to worry about it? What are what's the downside to that if somebody just doesn't deal with it?
That's a great question. I get this every year. The Part D plan, or the drug plans, is a mandatory voluntary program. If you think about that for a minute, it doesn't really make sense. And you're right, it doesn't. but it's voluntary in the fact that you do not have to enroll a drug plan when you first become eligible for Medicare. However, if you don't, and you decide 2 years down the road that you then want to add drugs, they're going to charge you a penalty. It's 1% per month of the national premium average, 1% per month that you were eligible but not enrolled. So if you stay out for 2 years, that's 24% of the national premium average that you will pay a penalty above and beyond the premium of whatever plan you choose. And here's the great part. It lasts for the rest of your life. It does not end after just the 24 months. So it's very important that even if you don't take any medications, the lowest program out there is $6.90. It's worth it to pay $6.90, not have any medications, and avoid that penalty going forward.
Perfect.
Awesome. I got a question coming in, and that was leading to my next question. So when Kim is asking, she turns 65 next June. When does she need to enroll? So I guess that's the overall question. When do we enroll for Medicare?
I'm going to answer that one real simple. 3 months prior to your birth month is the earliest that you can enroll. Now, the enrollment that you're doing is you're enrolling in actual Medicare. You're not enrolling in supplemental coverage. You're not enrolling in drug plans first. Part A and Part B make up original Medicare. Part A, you're automatically going to receive when you turn 65 or qualify under a disability. Part B, you have to elect. And so you have to decide at that point how you're going to receive your benefits. Are you going to take Social Security at that point, or are you going to defer it? What that determines is how Part B is billed to you. And Part B does have a cost associated with it. If you're taking a Social Security check at that point, they're just going to draft it straight from your check. It's very simple, straightforward. You're ready to go. If you defer it, they're going to send you a bill in a quarterly format. So 3 months is your window. I will say right now, but due to COVID restrictions and people working from home, people are not available like they used to be by just going down to the Social Security office. So if you can bring anything out of this meeting at all, ssa.gov, the Social Security Administration's website, is where you will start. You go there, you create your profile, and you follow the path that says to enroll in Medicare benefits at this point. And then you're on your path. So you'll get a Medicare number, you'll have a Part A and a Part B effective date. That's when you then contact the rest of us so we can help you with the other pieces.
Okay. Then that leads into another question on, I'm retiring next year. Should I sign up for Medicare if I have a company plan now?
Well, therein lies a really good question. So you do have the option to defer your enrollment into Medicare if you have prior credible coverage or a credible group plan. You can defer that Part B enrollment, keep the group insurance, and you will be deferring that Part B portion. So you do not have to enroll in Medicare. Now, if you're going to retire, and say you retire at age 69, that meant that you deferred your Part B enrollment for 4 years. So then you have to enroll in your Part B. So your Part A effective date would be when you turn 65, but your Part B would be at the date that you decide to enroll or retire and leave the group plan. These dates are what trigger our ability to write you on supplemental coverage, either under an open enrollment format or a guarantee issue format. They are two totally different things, so don't be confused about that. Open enrollment is when you either first become eligible or your Part B effective date. Guarantee issue could be loss of group coverage, and it would be the date that you are leaving the group plan. There are other opportunities that you could get into guarantee issue also by moving state lines or loss of Medicaid coverage or something like that. But that is the most common format that we see.
Of course. Go ahead, Tanya.
Well, some people go ahead and enroll in Medicare Part B, and they stay on their group plan. I don't think that that's really the wisest choice, but people do it. Chris, what are your thoughts about having both?
So it's a tricky proposition. So let's say you have A and B and you stay on the group plan. Okay. At that point, you have to determine who is primary and who is secondary for coverage. If you do that, depending on the size of the company that you're with, and let's say that Medicare is primary and the group plan is secondary, you still have to satisfy all the deductible rules of Medicare as well as the group plan before you receive benefits. So to me, the value of staying on the group plan at that point doesn't make sense. Now, if you deferred your Part B enrollment and you have the group plan, then the group plan is always primary, and that makes sense. Now, the question is, why would I leave the group plan and go to Medicare? So we have to look at the overall cost structure of what the group plan is costing you versus what Medicare is going to cost you, your access to physicians and medications. There are situations, two different situations, one by which an individual may have a large list of very complicated name brand medications that Medicare just will not cover at the same rate or same cost structure as your group plan would. So in that situation, I would advise you to stay on the group plan so that your medications are covered right. The second scenario would be if you're a high income earner, there is what's called an IRMA out there in Medicare. It's an income related Medicare adjustment. It is Robin Hood at its finest. It says that if you have high income, we're going to charge you a subsidized rate on your Part B and Part D premiums. The highest rate this year is going up to about $527 if you made over $300,000 on your prior year's tax return. Well, that number combined with what the supplement cost is going to be, the drug plan, the drug plan increase can go up an additional $80 a month. We have to add all those numbers together and say, okay, the cost for going to Medicare is more than if you're stay on the group plan and have the premium.
Yeah.
And that's a very complicated equation. That's one I handle a lot of, but we have to do the due diligence on the numbers to make sure that that decision makes sense going forward. The other thing to always think about in that situation is spousal coverage. If you decide to leave, retire, what does that do to maybe a younger spouse? And Tanya, I know you get into that quite a bit because at that point, you're looking at trying to find individual insurance for somebody that's 62, 63 years old. The cost is significant.
Right, absolutely. And then we can get into Cobra later, but that's always confusing as well. When is the spouse eligible for Cobra if the Medicare eligible employee goes on Medicare? But there's a lot of different scenarios. And I know you and I are dealing with someone right now trying to decide if Medicare is better or staying on the group plan is better. And it's absolutely because of what you just explained with the income situation. So like you said, you can pay into it for all of your life, right? And then still not get what you think you might expect to get when you retire or when you're.
Yeah. And it's sad. The guy has he had $3 million in income last year, but he's going to pay a slammed penalty for making good money. And that's why I say it's Robin Hood.
Yeah.
They're taking it out of one pocket, giving it to the other people to subsidize the overall picture.
Yeah.
So it's not fair. It is what it is. And we just try to do the right thing we can for each of our clients.
Thank you.
I got a question coming in. It might be pretty specific. So you just let us know if this is one it has to be off of. But I am a retired naval officer on Medicare A and B and TRICARE for life. I am hearing about a Patriot option. How does that work?
Tanya,
I've got nothing on that one.
This one, okay. So a Patriot option is a Medicare Advantage product that is health benefits only without any kind of drug interaction. The only value that I see in that is if you do not have access to physicians in the area where you live. The best insurance out there in the world that I have ever seen is TRICARE for Life. If anybody comes to me and says, should I leave TRICARE for Life for what I'm seeing on the TV? Absolutely not. It is phenomenal coverage. Congratulations to you for having it. Thank you for your service. Whatever you do, don't do anything that's going to intervene with leaving that process. That is a fantastic coverage, and you're well taken care of. Now, if you're struggling with not being able to have access to physicians for some reason, it's my understanding, TRICARE for Life, you don't have to just go to the VA for physician coverage. So I don't see a reason why you would want to go to a network-based product for some unforeseen benefit. Does that answer the question?
Yeah, I think that does. Awesome. Kind of switching topics here. So, there's A, B, C, D, E, and F. Can you kind of briefly go over like what are these different types of parts, just in case we don't know exactly what they are?
I can do that easy. Don't get confused between parts and plans. They share similar titles. They're distinctly different. Part A, hospitalization. Anything that happens in the hospital falls under Part A. Part B, anything that happens out of a hospital. Doctor's offices, specialist offices fall under Part B. Part C, Medicare Advantage. Medicare Advantage is the outsourcing of Medicare to private insurance companies. They fall under HMOs, PPOs. Your medical decisions are dictated by private insurance companies. That's the easiest way to understand that. Part D, drugs. Easiest as you can go. Then you get into plans. Plans fall under supplement plans. This is specific to Medigap policies or Medicare Supplement plans. They range from A, C, D, F, G, L, M, N. It's confusing.
You just told us not to be confused, Chris.
Sorry, it is confusing. Understand that each plan type, title, F, G, C, D, is a level of coverage. It's kind of like the way we used to buy cars. Do you want an automatic transmission or a 5-speed? Each one of those decisions determines what your cost is going to be. You want electronic windows, you want manual cranks. Each decision determines what your cost is going to be. So Medicare Supplement plans, Plan F historically has covered, check the box in every category. You pay your premium, you have Medicare, you don't pay anything else. It covers deductibles, co-insurance, everything else out there. Now, for anybody turning 65 after January 1st, 2020, your most comprehensive option is actually Plan G. It covers everything except for the Part B deductible. It is lower premium than Plan F because you're not paying the Part B deductible. But you also won't have access to it if you turn 65 after January 1st, 2020. You go all the way to the end of Plan,
Because they took that away, or they?
Yeah, they took it away. The option is no longer there.
If you're grandfathered and have a Plan F, typically you can hold on to that, right?
You can keep it. And also it falls into, if you deferred your Part B election, say when you were 65 and now you're 69, you turned 65 prior to that date. So you do have access to Plan F going backwards.
Great.
So that's that guarantee issue thing that is very specific to an individual. And it's also very complex to understand.
Great.
So
Plan G really is the new Plan F, basically.
It is the new Plan F for going forward. So for every other title of either Plan A or go all the way to the end of Plan N, it drops off certain levels of benefits. So Plan F adds a copay in for your doctor's visits, but it doesn't cover excess charges. So depends on your level of comfort, what you're willing to risk versus the comprehensive coverage that you're looking for.
Just
awesome.
Can we get
a little bit more into what Plan Part D is and what are the different prescription plans that are in there?
We can. Like we said earlier, there's like 26 different drug plans in the state of Texas. The plans differ between premium, deductible, and then each drugs are determined by a drug tier system or a formulary. The standard tiering process is tier 1 are your generics, tier 2 are your non-preferred generics, tier 3 are your name brand drugs, tier 4 are your non-preferred name brand drugs, tier 5 are your specialty drugs like your leukemia cocktail drugs, very high-end, very expensive medications. Depending on where your medication falls in there determines the cost. The higher the tier, the higher the cost. What's unique about all the different drug plans is that one company could determine that say lisinopril is a type tier 1 generic medication covered at the lowest possible cost, but another company could determine that that's a tier 3 name brand drug. Even though it's in the same drug category, the companies get to determine the tiering of that, not Medicare. So that tiering process determines what you're going to pay out of pocket. The specifics to the drug plan is very difficult to understand, but there is basically an initial coverage limit. There is what's called a donut hole, and then there's the catastrophic phase. We could do a complete hour-long webinar on just the drug plans, how they're calculated, what the donut hole is, what catastrophic coverage is. Just know that there is a system out there that we use. We plug in your medications, we plug in your zip code, we plug in the pharmacy of your choice, and it will give me an annual number that I'm looking for. What I'm looking for is your total annual out-of-pocket cost at the lowest possible price, at the lowest possible location. And then we back into preferences from there. Some people just don't want to go to Tom Thumb and they have to go to Walgreens. Well, here's the cost difference between those two options, right? If it's $20, we can absorb that. If it's $2,000, we need to make a change. So again, if we wanted to do a full Part D webinar on that, I could go for a long time talking about it. It's very complex.
And one thing I would say is don't get caught up on the insurance company name. So somebody may have a plan F with Blue Cross Blue Shield. So maybe they just want to say, let me just stick my drug plan with Blue Cross Blue Shield and keep it simple, one bill. But that is not in the best interest of that member, because they might be really paying a whole lot more than they need to pay. So it is literally very, very customized to each person's usage. Right?
Sounds like it.
Absolutely. Absolutely. I've even seen it recently to where the difference between a specific capsule versus a tablet was a $1,500 annual difference.
Wow.
Crazy.
But we get that specific into each specific dosage, milligram counts, everything, mail order. It's a lot. It's a lot.
Chris, would you say it's so confusing and so broad because prescription drugs are really one of the top cost drivers with healthcare?
Oh, absolutely. I mean, I think our senior population is over medicated to begin with. I'm not a doctor. I play one on TV. That's, it's just my opinion. I see way too many similar medications. I've had diabetics that take 5 different diabetic drugs all at the same time. And I'm like, does your endocrinologist even understand that they're repeating these medications of the same types? But the interesting change that's gone on within Part D is during Obamacare, they were trying to get rid of the donut hole. And I could explain that in more, but anyway, the drug manufacturers now are challenged with offsetting costs once you reach a certain level. So now there's much more interaction between the drug manufacturer and the insurance company together to try to decrease drug costs. But always understand this is that they're driving all costs towards generics. Generics is where they're saving the most amount of money because they have the lowest wholesale cost numbers associated with those drugs. So part of my job is to figure out what's going to be the best plan option for you, and I'll explain it to you why. I'll show it to you in documentation. It's not something that we really even make money at because there's not any money in it. It's as a benefit to a beneficiary to do this for them.
Right.
Sounds extremely complex. I don't know how someone would try and tackle that themselves. So I'm sure you're going to be getting a lot of people asking questions on their specific medications.
Absolutely.
Remember, audience, there is a Q&A box down there. Please fire those questions off. I can try and address them. But a real kind of a question to raise other questions. Tanya, what would you say is the most frequently asked question that you receive when it comes to Medicare, when you're talking to your clients?
Oh, I wouldn't say there's one. I mean, everybody wants to start early. Number one, when should I start looking at Medicare? And does this open enrollment period pertain to me? We get that a lot. And obviously, right now, the news, there's a lot going on. And I would say that the majority of our clients do choose Medicare supplement plans, which don't really, they don't apply to the open enrollment period. And then the retiree, if they want to retire, can they afford to retire? What does that look like? And especially if they've got a younger spouse. I mean, that is very, very common these days. So, and then we will make some recommendations and we'll consult with people. And then a lot of times people will say, well, I talked to my brother or my neighbor, and this is what I want. So we get that too. So just be cautious of that. I think there's a lot of confusion surrounding it. So that's why it's important to get your kind of your tribe and people to go to. But I know there's not just one main question, but they do start early. So that's the key. I think the key is you don't have to start working on it when you're 60 years old. What am I going to do for Medicare? Because things change so rapidly. And like Chris said, 3 months before you turn 65, let's start talking.
So what's good for your neighbor is not necessarily good for you either.
That is right. What is good for you? Don't do what your neighbor says.
I draw a different scenario. A lot of times I play golf, and for a lot of golfers, you'll have 4 guys that'll set up on a tee box, and you'll have the best golfer in the group just smoke one right down the center of the fairway, and the worst golfer in the group grabs his club and says, "Man, let me hit that club." The club is not going to change the man, right? That club is not going to work for everybody in the group. That guy can hit the ball better because he's a better golfer. So not one plan works well for everybody. Not one plan works for the same household. There's so many different things that go on there. I want to answer your question that Tanya just answered, if you don't mind as well. One of the things, the questions I get all the time are, what are these TV ads talking about? And what are these radio ads talking about? And what am I missing out on? And should I be looking at this? And what about dental and vision and hearing? And why did they offer it? And my plan doesn't. That is probably the biggest question / concern I have in our marketplace. Medicare does not cover dental, vision, or hearing. Insurance companies don't want to cover dental, vision, and hearing. The question is why? Because as we age, the first thing that goes is our teeth, our eyes, and our ears. Insurance companies cannot make any money on an insured product for that. Well, these Medicare Advantage plans, these private insurance companies know that that's an advantage point that they can advertise to get you into their programs. Just be careful. Beware that it's not always what you think or see in an advertisement. Understand all advertisements are strictly trying to bring you into the fold, get you interested, start the dialogue. Be careful, because that's not necessarily what is being represented. That's about all I can say on that piece, because I get those questions all the time, and I have to be able to explain why you're hearing so much about those things.
Awesome. I've got a little bit of a specific question, but that might be able to help some other people in the audience. So I have coverage at work, high deductible with an HSA. I made the mistake of applying when I turned 65 and only found out later that I could not contribute to the HSA when having Medicare, despite not using it. I tried to reverse the start window within 30 days, but have not gotten any confirmation it has been canceled. Any easy way to find out?
Well, I think the best thing to do is to get with their CPA and try to reverse it. What do they want to do? Do they want to delay Medicare Part B, or what's more important to them, contributing to their health savings account or delaying Part B? And this comes up a lot. A lot of times people will delay their Part B enrollment because they really love contributing to that health savings account. But if they've done something wrong in the eyes of the IRS, then first thing is to admit, you've made a mistake. How do you correct that? And I guess starting with the Social Security office, Chris, was that where is that where you would start?
Well, yeah, you have to opt back out of Part B and defer that enrollment because you have prior credible coverage of the group insurance, at which point you could reinstate the HSA as long as you can get back into the group plan. Hopefully you never left it. Just know that by going to Medicare, obviously you just said that you can no longer contribute to the HSA, but you can use the HSA funds that are there to fund a supplement and to fund some of your Medicare coverage. So all is not lost. However, the only way to continue to contribute is to opt back out of Medicare. And like I said earlier about the Social Security Administration not having access to people, it's very hard. It's like moving the Titanic on a pond sometimes. You just have to be diligent, continue to make the phone calls, continue to provide the documentation, and eventually you will get it done. But you have to maintain, you got to be in their face, on their phone, bugging their ear, and hopefully you'll catch the person that can actually do it for you at some point.
I would say document and have something in writing so that you realize, oops, I might have messed up here. I want to fix this. And so if the IRS cover ever comes back to you, you've done your due diligence and you can prove that.
Awesome. Another question, what is the criteria or factors that you would make you choose a Medicare Advantage plan versus the standard A and B?
I'll just go real quick and then I'll let Chris. I mean, the best of both worlds is to have your Medicare A and B and your Medicare Supplement, because everybody likes freedom. We want to be free. We want to go where we want to go. And that's going to give you the most freedom. While you're going to pay a monthly premium to have your Medicare Supplement, you're not going to be tied to an HMO or a PPO network. So that's the best of both worlds. And your out-of-pocket is going to be lower. Medicare Advantage, I would say, is more for, in my opinion, maybe a lower income household. I could be wrong. Chris can correct me with that. But once you get into a Medicare Advantage plan, because it might be what your cousin has or your brother has, or it's cheaper, it's not always so easy to go to a Medicare Supplement plan. So
yeah, I'll even add to that. It's not only is it not easier, 9 times out of 10, when somebody wants to come back to a Medicare Supplement plan after choosing Medicare Advantage, they have to go through medical underwriting. 9 times out of 10, the reason they're making that decision is because there is a underlying medical condition that's causing them to want to come back. I'll give you a sample. I had a call from a lady this week. Her husband has been diagnosed with Parkinson's. He has been directed to physical therapy and speech therapy and occupational therapy 3 times a week for each one of those. And he's showing progress. The insurance plan decided their advice was to move him to a nursing home. But the doctor showed progress in his therapy, so the doctor wants him to go to these therapies. Well, that therapy unit is not in network, and because it's an HMO, she has to pay 100% out of pocket. Even Medicare doesn't cover at that point because she's opted out of Medicare. So she wrote a check for $22,000, calls me and says, the doctor's advising me that I need to be on conventional Medicare with a supplement because it would pay 100%. I have to be the one to break the news to her that she made a bad decision in the beginning and is no longer eligible because of the state of his health. That scenario plays out with me at least 4 times a month, of people that want to come back to supplements because they thought it would be cheaper to go the Medicare Advantage route. And they're right, it is cheaper for that year until you need it. That's when it gets you, is on the back end. And if you ask me what I have for my parents, what's the most comprehensive coverage I can get, it's going to be a Medicare Supplement plan. Medicare dictates whether something is covered or not. The supplement automatically pays their portion. There's no discussion involved. The other way, the private insurance companies are deciding your health and deciding what is covered and at what rate. And that can be a difficult proposition. So your first decision is your most important one because you don't have to worry about medical underwriting and going to a supplement. If you decide to change later, just know you can't get back without going through. You can't buy car insurance after you wreck the car. It's the same situation with a supplement. You can't come back once you actually need it.
Awesome. Awesome. Let's see. Let's go to another question. Kind of a random question. I can pay for part A and B with a credit card. I can pay for part D with the credit card. I cannot use a credit card for part C. Why not? Any ideas?
No.
Okay. That's probably some Google's going to have to help us out with.
Part A, there is no cost unless you didn't pay into the Medicare system and you're buying it outright. So part A really shouldn't be a factor. In part B, the only way you would pay that with a credit card is if you deferred taking your Social Security check. And I don't know whether Social Security is set up that way. I think it is. You can pay online with a credit card. Medicare Advantage plans, I don't know. Some of them are set up for credit cards. Some of them aren't. Probably most of them require a bank draft.
I think it's specific. It's probably specific to the insurance company.
Yeah.
Another question from David. I'm 74, still working, and have good insurance. If I sign up for Part B in a supplemental insurance, will it pay what my insurance does not pay?
Well, you can't have both. You can't have Medicare and a supplement and a group insurance plan at the same time. You have one or the other.
Okay.
Your group plan would work as your supplement in that case.
So
If you had,
your group plan would be your supplement, but you couldn't have an additional supplement on top of it.
right, no, there would be no need. You would be wasting money. The one advantage is, a lot of people that are still working, they have employer contribution towards their health insurance. It's just sometimes it's fear of the unknown. What is this going to cost them? What are they giving up? So it takes that consultation, because what they may realize is, you mean I can pay less, and now my $6,000 deductible plan with my employer, now I really only have to pay my Part B deductible, which is what, 140, Chris?
203.
203. I'm up a little bit. Sorry. So now they're out of pocket for anything medically related. It goes from a $6,000 deductible to 240.
203.
203. That's it. So once you show them that, they may say like, well, wow, why didn't I get on Medicare years ago? This is a good deal. So.
Okay. Let's see. Why do Medicare commercials make the Advantage plans sound so exciting and cost saving?
Because it's TV.
Let me put it into perspective this way from a financial standpoint. And I've got to be a little bit sensitive to things that I say so that it doesn't affect my marketing certification and my license. Medicare Advantage plans get paid $1,000 a month, whether you go to the doctor or not, if you're a member of their plan. So if you want to do the math on how that works, let's say there's 14 million members. Think about how much money they're getting per month, whether you go to the doctor or not. That's how it's a zero premium product. Is it a no-cost product? No. The government's subsidizing that money. They're paying on your behalf to have that plan at a zero premium cost. Why is the government doing that? It diverts the cost off the Medicare system. So therefore, if a company knows that they're going to get $1,000 a month per individual, they want as many members as they can get, because they then get to control the utilization of those benefits. I hope everybody hears me when I'm saying they control the utilization of your benefits. Yes, it takes stress off of the Medicare system because it's being outsourced. So the government is somewhat proactive with agreeing to the terms of those plans. But the people that are buying those plans are not necessarily in an income range that would necessarily make sense for your clients. Hopefully I answered that in a way that makes sense to everybody.
Awesome. To kind of sum up, to bring it all together, what would you say if everyone got one piece of advice or information from this? What would you sum up about Medicare that they need to know?
I'm going to be very specific on that. Find somebody that's an advisor. Find somebody that's a broker that does not work for a specific insurance company. Find somebody you feel like you can talk to and you can trust, and seek advice. Don't try to do it on your own. There's too many options out there. There's too many breadth of products for you to try to do it on your own. A 15-minute phone conversation with a good, qualified, certified, trained broker will save you money in the long run.
And broker, I don't know that I love that word because we're so much more, but independent. What you want is you want to work with an independent specialist. Yes, we're called brokers, we're called agents or whatever, but work with an independent, which is what we are, because like Chris said, there's 26 different drug plans. He's going to put them with the right one that's best for them. If you call an insurance company directly, they will absolutely enroll you in one of their plans. They will, because they want to, but you're only hearing about their plans. So that is the best advice that we can give you. Just like with financial advisors, you're not going to put everybody's money in the same place, right? It's the exact same way with this.
Awesome. And then I've got 2 or 3 people that are asking, what is what is the fee or what is the cost associated with you guys?
We charge $1 million per call.
Awesome.
You're going to be really surprised. I mean, the commissions are built in. So we only get paid if someone buys a plan. And those commissions are not even negotiable. And it's not a ton of money. I think there's more money on the Medicare Advantage plans. Maybe if I'm speaking out of place, correct me if I'm wrong, but I do want to say this about Chris, and when you're working with the right person, is when somebody will take the time to spend time with you, get to know you, do your evaluation, and say this drug plan is best for you. And Chris won't even say, I'll help you get enrolled, but nothing. There's no compensation, because if it's what's right for the client, that is what we're going to do. And oftentimes we spend time and we do not get paid, but that is just that's what I love about Chris, and what I love about working with the right people is just doing the right thing. So Chris, would you agree?
Oh, I would totally agree. I mean, we're 100% commission based. The thing to know is that the commission that a company pays me doesn't change the rate that you would pay for the exact same product, whether you went direct or you went through me or not. That's the same price to you. They pay me a commission on top of that. But I will say this, I don't, and this is probably to my chagrin, I don't make a lot of money selling Medicare insurance. I don't do this ultimately for the money. Luckily, my wife makes a lot of money with our other business that we own, and therefore I don't have to focus my attention on getting rich off of Medicare, because that's just not going to happen. And like Tanya said, there's 26 different drug plans. I may represent 2. I'm still going to put you on the plan that makes the most sense for you, because it's the right thing to do. I'm passionate about the Medicare business. I want to help people. I'm not a smoke and mirrors. I'm not going to blow smoke up your skirt. It's not me. I want to help you do the right thing for you from a long-term perspective. I think you have been on this planet for at least 65 years. You deserve a certain amount of respect, and you do not deserve to be taken advantage of as you age. And so that's kind of my task to my clients, is to know that I'm here for you. This is not about me. So that's the best thing to say.
I tell Chris that he's going to have a lot of jewels on his crown.
I hope, because I'm losing all my jewels, seem to be receding farther and farther back.
Perfect. Well, that's about wraps us up. I want to apologize if we didn't get to your question, your interview. We had a ton of questions come in, but if you have a question that didn't get answered and you're part of the Lake Point family, reach out to your financial advisor, whoever that is, and we can get that question answered for you. Also, I want to give everyone Tanya's information. So her email, it's Tanya, Tanya, at Tanya, TanyaBoydAssociates.com. Tanya Boyd and Associates.com.
Tanya Boyd Associates, yes. And if you want to email Chris, you can just put Chris in
Chris at
Tanya Boyd
Associates.com.
Associates.com.
Yeah. Perfect. Yeah. And office phone number is 972-203-8180. And then I see an extension of 802. Is that the extension that everyone should use, or just that?
You should get someone to answer the phone that can transfer. Yes, yes.
Perfect. As always, at Lake Point Advisory Group, we really enjoy our clients. We love to put on these events. This was a really great event. I learned a lot about Medicare, but I hope everyone else did too. Tanya, Chris, thank you for coming on. If you guys need to reach out, please reach out to them or your financial advisor, and we can get you guys hooked up. But again,
somebody wants the email. Yeah, somebody wants the email address again. I'm sorry.
Okay. So it's Tanya, Tanya, at TanyaBoydAssociates.com. And Boyd is Boyd. Perfect. I'll put that in the chat as well.
Thank you. I'm sorry
Awesome.
We didn't get to all the questions. We could go on for a long time, like Chris said. Thank you for the opportunity.
Yeah. Thank you guys. Have a good one.
Take care.
Bye-bye.